Hi, my name is Nobie Mitchell. I will be speaking with you regarding common open enrollment notices. I am a Medicare SHIP counselor, volunteer. You can make changes to your Medicare coverage each year during Medicare's open enrollment, which runs October 15th to December 7th. Around September, you will start to receive notices with information about any changes to your plan in the coming year. It is important to read and understand these notices as they can help you decide if you should make changes to your coverage during open enrollment. Point 1. Understand your annual notice of change and evidence of coverage. If you have a Medicare Advantage plan or a Part D prescription drug plan, you should receive a notice called an Annual Notice of Change, or ANOC for short, and an Evidence of Coverage, or EOC. Your plan should send you these notices by September 30th. If you do not receive these notices, contact your plan to request copies. These notices list changes for your plan in 2025. There are 3 kinds of annual plan changes to look for in an ANOC or EOC. First, look for changes to your plan's deductibles and co-payments, which can change each year. For example, your plan may not have a deductible in 2024, but could have one in 2025. Second, look for the changes to your plan's network. Plan networks can change each year, which means your doctor or pharmacy may not be in your plan's network for 2025. If you see an out-of-network provider, your plan may not cover any of the cost of your care. And third, look for changes to the plan's formulary, which is the list of drugs that the plan covers. Formulary changes can happen from year to year, meaning your drug may not be covered in 2025, even if it was covered in 2024. Even if it is still on the plan's formulary, the cost of the drug may have changed. After reading about the changes to your coverage for 2025, decide whether your plan will still be able to meet your needs in the upcoming year. Point 2. Learn if there are any problems with your plan. In October, plans leaving the Medicare program in the coming year send out a plan non-renewal notice to people enrolled in the plan. If you receive this notice, you should make sure you are covered in 2025. You can choose to enroll in a new Medicare Advantage plan or Part D plan during open enrollment, which is again October 15th through December 7th. You can also enroll in a new plan up until the last day in February. You will be disenrolled from your previous plan starting January 1st. So if you do not pick a new plan by then, you will likely experience a gap in coverage until you enrolled in a new plan. In late October, Medicare will also send a consistent poor performance notice to people enrolled in a plan that has received a low rating for 3 or more years in a row. A low rating is 3 stars or fewer out of 5. The notice encourages you to look at other plan options in your area. Point 3. Identify marketing violations. In October, you will likely start receiving mail from different insurance companies about the plans they offer. You can use this marketing information to compare your options. Although companies can send you mailings, you should know that they must follow certain rules when marketing their plans. These guidelines are in place to protect you from aggressive or misleading sales and enrollment tactics. For example, a plan cannot use language that suggests their plan is preferred by Medicare. They cannot call or email you if you have no prior relationship with them and did not ask them to do so. Plans should not leave information like flyers on your door hanger, on your car, or at your home if they came from a company that you did not have an appointment with. When contacting plans, remember that you should take your time to renew choices and make an informed decision. Point 4. Read your Medicare statements to detect potential fraud, errors, or abuse. If you have original Medicare, you should receive Medicare Summary Notice, MSNs. If you have a Medicare Advantage plan or Part D plan, you should receive Explanation of Benefits, or EOB. Both provide a summary of the services and items you received and how much you may be billed from them. Reading your MSNs and EOBs is important for detecting potential Medicare fraud, errors, or abuse. Keep the following tips in mind. Review your Medicare statements as soon as they arrive. Keep notes of your medical appointments and compare to these statements. Confirm that everything listed on the statement is accurate. In other words, that you actually received all the services or items. Contact your health care provider if you have questions or notice any mistakes on your MSNs or EOBs. Contact the SMP for a My Health Care tracker, which helps you keep track of your appointments, or to receive assistance reading your Medicare statements. Take action. Contact your Senior Medicare Patrol, SMP, if you see Medicare statement charges that seem suspicious. Contact your Medicare Advantage plan or Part D plan if you don't receive an ANOC and EOC by October. Contact your State Health Insurance Assistance Program, SHIP, Adrienna Martin at 706-675-1517 or call 1-866-552-4464 and select option 4 to speak to a certified Medicare SHIP counselor if you have any questions about Medicare or your notices.